Hey, if your eyes have been itchy and red the past few weeks, you're definitely not alone. It's dry eye season in Minnesota, and the doctor who performed my LASIK surgery at North Suburban Eye Specialist in Blaine last February, remember that? Yep. Eyeballs under the laser, and he made it possible for me to throw out my glasses for good, and he's back today with some relief for dry, itchy eyes. Dr. Mark Lobanoff is here with us today. Hi, Dr. Lobanoff.
Hi, how are you?
Look, doesn't that bring back happy memories?
It's like it was yesterday.
Yeah, it really is. It's like it was yesterday. But I, along with a lot of people, I mean, I know after you have LASIK, a lot of people use eye drops because you have some dry eyes, but everybody right now, because it's getting a little drier, a little cooler, is that the deal?
That's right. As the weather starts getting colder, not only does it hold less moisture, but we start heating our homes, we start heating our cars, we dry that air out even further.
Yeah.
And so a lot of people start experiencing dry eye symptoms.
And so what are those symptoms?
Symptoms are the eye will turn red, it will feel gritty or scratchy, just feels dry, feels irritated, like you want to put some moisture in it.
It is a very distracting thing. When you think about those little things that bug you, if your eyes don't feel great, it's like everything else is very annoying.
Your whole day can turn on it. And
Yeah.
it can be mild or it can be quite severe. So
Okay, so what are we looking at here? Because I know you're going to tell us about what causes the problem.
some of the causes, well, there are glands that produce tears for the eyes, and as the glands start to get inflamed, they produce fewer tears and tears that are of less quality, and these tears will evaporate more quickly than regular healthy tears. And that's when you start having the dry eye symptoms. And you can see the eye will turn red, again, as you mentioned, itchy, scratchy, just generally irritated.
Okay, so you brought some good ways, though, to help us treat this. And there's over-the-counter ways, there's prescription ways, and even a little teaser, some snacks that you can eat to help make your eyes in better shape.
That's right. We can
Okay.
change our diets, but the most common thing that most people will do for dry eye is just use over-the-counter eye drops. And these will come in different varieties. There's regular eye drops. There are preservative-free for those patients whose eyes are a bit more sensitive.
Yep.
Thicker gels, and even some ointments for patients that really have severe dry eye or dry eye at night.
Okay, so what is the benefit of a gel over like the regular, because that stuff in the green, that's what I use pretty regularly.
These are great for daytime use. They're a little thinner.
Yeah.
They're not going to blur the vision as much, but they provide relief, but they don't last as long.
Oh, okay.
At night when you're sleeping, an ointment is great. It lasts the whole night long. You don't have to keep reapplying it.
So you take that this ointment stuff?
That's
Is it
right.
like thick or is it?
Build it up.
Well, here we go,
That's
everybody.
right. Almost like suntan lotion.
Oh my gosh.
And it melts overnight and lasts in the tear film and really protects the eye over the nighttime hours.
You just squeeze that right into your eye?
That's right.
And it's not going to hurt or anything.
It will not hurt.
It looks like Neosporin.
Don't use Neosporin. This is much better.
Okay. Yes, don't use Neosporin. Okay, sounds good.
So some other things we can do, dietary. A lot of American diets are low in omega-3 fatty acids. Fish oils, particularly extracts of fish oil, have a lot of omega-3. This reduces inflammation, helps reduce the inflammation in the eye, and treats the dry eye.
Nice, okay.
And for those patients where over-the-counter products are not enough, we do have prescription drops. There's a product called Restasis, which decreases inflammation, gets patients to make more of their own natural tears over time.
And then you just use that regularly?
It's a drop that's used twice a day.
Okay, and then what about trying to prevent it? So when you're thinking about things in your house, in your room, all that kind of stuff.
Generally, anything you can do to reduce airflow. So if you sleep in a bedroom at night that has a fan overhead, you want to turn that fan off.
Oh.
Using a humidifier within the room itself is very helpful.
So maybe get yourself like a sound machine if you need the sound.
That's right.
Okay.
That's right. Something
Yep.
more soothing that way. The vents in your car, direct them away from your face so the air is not blowing directly on the eyes. And if you can't put a humidifier in your office space at work, you can often put plants which respire and send water into the air.
Well, that's excellent. Okay, and then what about some medications that might cause more of a problem?
These are things that you can review with your doctor, but antihistamines, antidepressants, some blood pressure medications known as beta blockers, decongestants, things that we take during cold season, a lot of those things will dry the eye.
Well, that would make sense because if they're drying up your sinuses and things like that,
They're drying the eyes as well.
it's all connected. Okay, I promised that we would talk about some foods you can eat because I always like to have an excuse to be like, well, I must eat this for the health of my eyes.
That's right.
Carrots? No?
Carrots, they're good, but for other reasons.
Okay.
But foods that are high in omega-3 fatty acids, walnuts, flaxseed, grapeseed, fish, oily fish, such as mackerel, tuna, salmon, sardines, these all contain a lot of omega-3 fatty acid. if you're not a fish lover, again, over-the-counter supplements can work too.
Those fish oils. This is awesome. Good advice. Thank you so much, Dr.
Absolutely.
Lobanoff. Hey, if you still have questions for Dr. Lobanoff, it's great news. You can ask him anytime. You just go to KSTP.com, click on Twin Cities Live, and then look for the words exclusively on TCL, and that's where you can submit a question right to him, and he'll answer it. All right, still to come on